It is a pleasure to be here, and John and Jan, I hope if you have me back in 3 to 5 years, we will be filling up several rooms, if not the entire hotel. I was even more delighted last night when I got a chance to join you folks for some refreshments that some of you still were nice to me. What Jerry was kind enough not saying, I spent 10 years as an insurance regulator and developed a lot of the small group reform work. And actually, I'm going to tease Lindy here a minute. Lindy Pridgeon told me when I left the Department of Insurance, where everybody had to be nice to me, he said, "Alan, you don't understand that past advisory board chairs and past regulators are a little bit like runway behind you in terms of an airplane pilot, and that you have absolutely no use for them." It is, let me quickly say that my comments will not reflect my past capacity on the advisory board, though the opportunity to get to meet and hear from several of you there was a tremendous educational and growing experience. But these are my own comments. They certainly are not that of the Department of Health and Human Services, where I haven't completely gotten away from you folks. I'm trying to get the North Carolina Exchange up and operating, and hope that we'll have at least one, and maybe in talking to Jerry, maybe even have some of his operation come across the border to do business with our exchange in 2014. As I did a paper, about a 5-page thing that you can probably go to sleep with, and I don't know whether it's distributed or online, but I'll highlight my remarks, just touch on a couple of those things, and then invite you to go back and read the paper, or at least the section that I'm talking about. But as I thought about the challenge that's ahead of all of us, particularly you folks, the analogy of a race comes, particularly given the time frames we have, comes to mind. And then particularly as I thought about it, probably the high hurdles, that there are several hurdles that we're going to have to clear to get there, and do it all in the time frame. So I'm going to use that analogy and start immediately with hurdle number one, obviously, are the timelines. I don't know how many of you caught it or not, but Barbara Smith's boss, Mr. Larson, said, "You've got about 26, 27 months. At least with the Olympics, when you're preparing for the hurdles there, you get 4 years to prepare, and while a more prudent business development process would probably, all of us would want 3 to 4, the reality is you have to be ready, not just by January of 2014, that one gives you false comfort, but those of us who are going to be trying to get you to be a part of our exchange in that first year, that big take, we're going to be hooking you up and sending out information probably starting about August through September of 2013. So that's your marker. So hurdle number one is the time, and it's about 24, maybe 26 months. Second is what I would call is certainly, and again, I'm going to piggyback. Steve and I didn't collaborate on this, but I hope you caught his reference in his remarks, and Barbara may follow up some. Is you've got to have good financial backing. Most of us applauded, delighted that the authors of ACA were bold enough to, in fact, commit the monies that they did for the startup capital for co-op. And yes, I think there'll be sufficient, my bet is, Steve couldn't say it, that there'll be sufficient capital in there that certainly most of the folks represented in this room will be able to be operationalized in the first 7 years of their operation. However, and many of you touched on that earlier this morning, you have got to have other resources available, and those resources and financial support can come in a lot of forms, whether it's upfront capital, contingency capital, or in-kind services that we talked about so much this morning. But when you start thinking about, and I'll get to this in terms of the competition and the track conditions that we're going to be operating on in 2014, you have got to have the resources or a mechanism by which you, in fact, can get marketing. And yes, anything you pay for with federal monies, for God's sakes, it's outreach and education, but you got to do better than that, and you've got to have some resources. And in the paper, I touch on a couple of things that might help mitigate how you might get that get the word out in a more collaborative fashion with somebody, OPM, other people's money. Third is the right equipment. You folks are well ahead of that game here, whether it's the IT systems, right claims systems, whether it's the financial reporting systems and the like, and then getting them to work together smoothly. You can't afford to buy, you can't afford to build, either time-wise or money-wise. As was talked about this morning, you need scalability, both in terms of price that you pay and in terms of operation. And let me add one other and then say, look out for one other thing. You can't afford a legacy. And I'm talking about legacy systems here, and I know I'm going to offend some folks because you're probably talking about trying to leverage somebody's legacy system one more time around the lap, some TPA, but I've got to tell you, if you're building for the future, you've got to have open service architecture. And then the other one bit of admonishment I do here, if somebody on your staff, and I know you got 1,000 staff, excuse me, we're all, you are your staff, I know that. And I tried to start an HMO a few years ago, as Lindy can say, so I know what it is to be sort of a one-man, one-arm paper hanger. The reality is, if you're not plugged in to what's going on in your state in terms of the health IT development, the tremendous resources that are going into the provider side, and in terms of building the, if you will, the pipelines by which providers, labs, medical information can be exchanged, at least put that up on your radar screen and have that as a part of your long-range planning. Fourth hurdle is what I call the right teammates or right training partners. 2/3 of the business enterprises, and I don't know whether this is true in cooperative efforts, fail because there's a disconnect between what are the shared passion, vision, values, and time horizons. And let me underscore time horizon. Most of us go, yeah, we're all right on the mission, vision, and values, but the time horizon. If you're developing this enterprise, and if you look at some of the HMOs return to profitability and from the days in the past, we're probably talking about 5, maybe even 7 years. If you got a partner who's looking at, after 2 years, looking at you as basically being a revenue source and not trying to share in some of that risk or some of that development effort, that may not be the best training partner to be running the track with. The fifth and sixth, and this is the area I would invite you to draw from my paper, not now, I'll try to shorten it, but it's knowing the competition and knowing the track conditions. One of the great things, as we heard from many of you in the advisory board hearings, all of you were experts either in the field that you worked in or in your particular geographic area. So sort of almost a music man. He knows the territory. Most people probably don't know the music man, but anyway. All right. But the reality is that, do you really know it? It's not just how many people you think are going to be coming online in this new insured. It's their age, the relative risk of each one of those segments of the population relative to the risk that's currently insured. How many of those folks, or in what age, in North Carolina when we did our actuarial study, and I'll come back to that in a minute, it's a good source that you might look at. It turns out that probably 1/3 of the new lives to be touched by the exchange were eligible for that catastrophic coverage. Is that in your plan? Are you going to add that to your metal plan requirement? Should you? And if so, how's that going to reconcile with some of your provider networks who may not like catastrophic kind of plans? Gets back to the mission, vision, value, and sort of the timelines.